This is my Chapter 5 lab activity. I will be going through the static postural assessment of my lab partner, who is 4'11", 29 years old, and will be going by the name of Cinnamon. I will be looking up and down the kinetic chain to find any postural discrepancies or distortions. We will start at her ankles, at her feet. As we look at her feet, we can tell that they're in alignment. She has a good arch. They are not inward or outward. As I look at her posteriorly, we can see that her arch is still there. Her feet are in alignment, so that looks good. As we look at her anteriorly at her knees, we can see that they do not internally rotate or externally rotate, and they line up with the second toe. But when we look at her laterally, we can see that she does hyperextend at her knees, which can be a probable cause of an injury. As we continue to move up the kinetic chain, looking at her anteriorly, we are looking at her hips. As you can see, her hips are lined up evenly. As we move up, her shoulders are leveled, and her head is in a neutral position. When we look at her laterally, at the hips, we can see that she does have a slight lordosis curve, and that can be caused to weak muscles and the rectus abdominis area. As we move up to her shoulders, we do see that she does have a rounded posture. So some of the weak or underactive muscles that are indicative of a rounded shoulder are the middle and lower trapezius and rotator cuff. Some of her overactive muscles, the muscles that are tight, which are pulling her forward, are her pectoralis major muscles, pectoralis major and minor, and her latissimus dorsi. We also have the sternocleidomastoid scalenes and subscapularis that are also involved in the tight muscles that are pulling her forward. As we move up, we can see her head is slightly forward. Her ears do not line up with her shoulder, which is indicative of poor posture. In order to correct this posture, what we would have to do would be to strengthen her deep cervical flexors to allow the head to protract instead of come forward. And then what we would also do is include a stretching program for her upper trapezius, levator scapulae, sternocleidomastoid, and doing that stretch would help lengthen those muscles so that they would not allow her head to go forward. Some other exercises that would help for correction of her chin would be chin tucks, which can be done in a supine or standing position, and that's basically just retracting the head back and putting her in the correct posture she needs to be in. As we go down to the shoulders, one other exercise we can use would be scap squeezes to activate the rhomboids so that she can see where her posture needs to be. And slowly but surely, with the emphasis of these exercises, it would allow her to bring her shoulders back. And then in terms of her lumbar area, what we would do is include crunches, some planking to help kind of with the lordosis that is going on in her back. And then that's my postural assessment.